So this segment is on what do you treat and how do you treat it. I should probably get this out of the way so I don't worry about my hands and stuff. Okay, so what do you treat? Well, we treat chronic healthcare conditions. Really, that's our main focus. Autoimmune disorders, chronic Lyme disease, Epstein Barr, mononucleosis, arthritis, bone-on-bone arthritis, complex regional pain syndrome, migraine headaches. It's probably easier to make a list of what we don't treat, which is if you need surgery, this is not the right office for you, or a baby delivery, or basically a traditional medical approach. Now, the reason why we treat so many different things is because it's all about putting the body in balance. So when the body gets out of balance, that's when you get sick and symptoms. And so symptoms are kind of like when you're driving down the road in your car and you see the oil light come on. I mean, that's a sign that something's wrong. You need to change the fluids or check the engine. And that's what symptoms are. And then you get a diagnosis. And so much of the medical treatment is let's give it a name, let's diagnose it, let's name it, and then we blame it for everything and then contain it, which means usually there's a prescriptive medical approach that doesn't really make people better. Hopefully it doesn't make them worse. I mean, we have some unwanted side effects. Our approach is completely different than that. What we're trying to do is we want to put everything into balance. We want to get the energy back in with vitamin C, which is an electron donor. We want to reset the nervous system so you get rid of those, disease pathways and those chronic pain patterns that sometimes they get stuck inside the nervous system. We want to help the hormone system with natural hormone precursors, or what they call NHP. And so that's giving the thyroid building blocks instead of giving a thyroid medication. Instead, we want to help the adrenal glands to be functional. We want to help either the male or the female, gonadal tissue to work right. We want to detox the body through the liver and the kidneys, and we want to reset, the different energy meridians through acupuncture or advanced acupuncture. So what we treat is literally anything that's chronic or out of balance except for emergency medicine and baby deliveries. And it's not just me saying it. Matter of fact, I wanted to show this. This is actually on our blog, and you'll see all of these amazing patient success stories of gastroparesis and healthy skin and epilepsy and, rheumatoid arthritis. It just keeps going on and on and on. And the reason why we get outcomes where most providers or most clinics fail and people are still looking for things is that whole balance approach. Now, I feel like it's important for you to know it's not that we get every single person better. I wish we could say everybody gets better when they come to the office. And that's not accurate. And if we told you that, or someone in the office said that we fix everything, it's because we're excited to work with chronic healthcare conditions. But we have people that don't respond to the treatment as well. What I'm excited to offer about is to try something new. And when we put the body in balance and we balance out the blood tests and the hormones and we get our three providers together and we really start to focus in, we get some fantastic outcomes. And that's what we treat, and that's how we treat it.